Morning, everybody. Welcome to the first, this is the first full committee meeting of the Health, Welfare, and Institution Committee that's not a presentation. I know there's a lot of people waiting to get in line because we have a lot of exciting bills to consider today, and apologize for being late. We were in another committee. I'd like to recognize the gentleman from Caroline for a motion.
Yeah, Mr. Chairman, I'm going to move, and I think we can do these two together. I ask that two measures go by for the day. House Bill 385, your measure, Mr. Chairman, and meaning no violence to the policy. Just think we need to work on some language.
Yes, sir.
And then House Bill 1399, Delegate Robinson's, if that could also go by for the day.
Without objection, those two bills will go by for the day. I wanted, by electronic device? Okay, we're going to take attendance of all of these good delegates here. Please record your presence on the electronic voting device. Looks like we have a quorum. So I have a few administrative actions for anyone in the audience and the members here. We are going to re-refer HB 94 to the Courts Committee. It's a legal custodian bill.
So moved.
Second. All in favor say aye. Aye. We are going to re-refer to the Courts Committee as well, HB 212, a bill by Delegate Hurst having to do with the foster care and the use of THCA oil. Do I have a motion? All in favor say aye. The bill is referred. Another bill by Delegate Collins, HB 471, to refer to the Committee on Courts. It's a health professionals, unprofessional conduct reporting. Do you hear a motion? Okay. The bill 471, all in favor of re-referring to courts say aye. That's it. And moving along, HB 584, Delegate Guzman's bills to re-refer to the House Committee on General Laws. It's a Virginia Personnel Act, hiring preference of state government for persons with disabilities. And do I hear a motion to re-refer? Okay, all in favor of re-referring the bill to general laws, say aye. Any opposed? HB 1057 to be re-referred to the House Committee on Labor and Commerce. Dawn Adams' bill, Delegate Adams' bill, health insurance and clinical nurse specialist. Is there a motion to re-refer to Committee on Labor and Commerce? Okay, it's been seconded. Has it been moved? It's been moved and seconded. All in favor say aye. All opposed? And HB 1127 to be re-referred to the House Committee on Appropriations. That's Delegate Glenn Davis having to do with therapeutic day treatment. Oh, never mind. Withdraw. And then HB 1488, a bill by Delegate Hudson in the Virginia Procurement Act area to be re-referred to the House Committee on General Law. So, is there a motion? Second. All in favor of moving it, say aye. Aye. Okay. I know at least one member has to leave early, so I was going to start not with the committee reports, but with a couple of bills that are just in full committee. And the first one would be.
No, page 6, and she's got the list.
Okay, you got the list.
Okay, so right here.
There are amendments to.
Nope. Who do we need to go first?
Okay. Okay. Delegate Herring here. Delegate Jones here. Delegate Head here.
He's on the committee.
Delegate Head, would you like to present your bill? You can do it from your seat or from there, your preference. Okay, terrific. We're, for the audience, we are considering HB 1562.
Thank you, Mr. Chairman, and ladies and gentlemen of the committee. House Bill 1562 deals with establishing licensure for music therapists. If you were here last year, you may recall we had a similar measure up before us from Senator Vogel, and she and I have been coordinating this a little bit this year as well. The action that we took last year was to refer this out to be studied by the committee. That has been done, and so what you've got before you now is, and actually, Mr. Chairman, we do have a substitute, which I would love to ask the committee's indulgence on adopting.
Do we have a motion to consider the substitute? Move the substitute. Second. The substitute is coming around.
And the substitute, just to let you know, what this does is makes it consistent with statutory authority to regulate other professions at the Department of Health Professionals, and eliminates the very specific requirement for licensure in the code, and grants authority to the Board of Social Work after recommendation of the advisory board to adopt regulations to set forth the education and clinical training, to provide for appropriate application and renewal fees, and to include the requirements for licensure renewal and continuing education. So that was left out of the initial bill drafting. I've always taken a position on additional licensure that I was going to oppose it absent one of two things, and that is either demonstrable harm in the absence of some sort of qualifications of the person providing the services, or increased outcomes, better outcomes, because someone was qualified. And in this particular case, after the study, we validated that we end up with both of those requirements being met, and either would, I think, be valid for that. But I know we've got some folks from the Virginia Music Therapy Task Force group that are here and might want to speak to that, Mr. Chairman. So if they are here.
Before they speak, does any member of the committee have a question for the patron? Okay. So I see your witness is on their way. Welcome.
Thank you, Mr. Chairman and members of the committee. My name is Tracy Bowdish, and I am a master's level board certified music therapist. I work at Sentara Neurology Specialists in Norfolk. But outside of that role, I serve as co-chair of our Virginia State Music Therapy Task Force. So we just want to say a huge thank you to the legislators from last year. Although we were disappointed to not get immediate licensure, I will say that also a huge thank you to the board and the Department of Health Professions. It's been quite an honor to have so many professionals take such an interest in our profession. And also, as part of the public comment period in that study, we had 10 folks show up for the public hearing, but we had 64 individuals, I believe, write in favor, all write in support of state regulation, ranging from patients to teachers, chaplains, nurses, neurologists, et cetera. So Delegate Head spoke to two important facts, and as far as the potential for harm, we are bachelor's level trained at minimum, and we have 1,200 clinical hours as part of our training. We also are certified by the Board Certification Board for Music Therapists, and that certification is accredited through the National Commission of Accrediting Agencies, so of certifying agencies. So we're working very closely with the American Music Therapy Association and the Certification Board for Music Therapists to make sure that our credential is regulated. And unfortunately, because it's not currently regulated in Virginia, we had school districts who said that they were qualified to determine who could practice music therapy. So in some very specific cases, that meant telling a paraprofessional to sing to a child while toileting him versus using music therapy. As far as the amount of outcomes that Delegate Head spoke to, there's a reason why NIH just awarded $20 million in grants to study music and health. So I'd be happy to answer any questions on behalf of the task force, and we thank you for your time.
Delegate Aird.
Thank you and good morning. On line 35, it states that no person shall engage in the practice of music therapy or hold himself out or otherwise represent himself as a music therapist unless he is licensed by the board. Would this prohibit someone who has obtained their licensure from the entity that you just referenced from practicing if they do not now then have this Virginia-specific certification? I want to make sure I'm interpreting this correctly.
Do you want me to? So what the bill directs is for the board to work with the certification board for music therapists, and the MTBC credential is a national credential, so we're not asking Virginia to reinvent the wheel as far as creating an exam or a whole new process. We already have that in place nationally with continuing education. And I'm not sure if this is what you're asking, but I'd also like to, along those lines, I think it's under music therapy licensure, item C, Roman numeral 2. We also are not prohibiting other professions from using music as long as it's within their scope of practice. So music therapists don't own music. We are just delineating the difference between music therapy and other healthcare professionals who utilize music.
Delegate, do you have a follow-up?
And Delegate Ayer, if I may, what I would anticipate is your concern would be addressed once regs are promulgated out of this, in the same way that in my industry in home health care, that there are provisions for you were required to be licensed,
Okay.
unless there are some other things that are in place which exempt you from licensure. And when Department of Health Professions or Department of Health promulgate regs, they will frequently put into place provisions for exemptions for people if they've met the certifications, whether or not they have the license in place. So I think I would anticipate that we would see that. But again, that's going to be what's promulgated out of regs. So.
Thank you. Follow-up question, Mr. Chairman.
Delegate Ayer.
Separate question. I just wanted to better understand the difference between the Virginia State Task Force and the board, the advisory board that you're hoping to form.
Okay.
I see Dr. Brown has risen.
Mr. Chairman, members of the committee, David Brown, Director of the Department of Health Professions. For a number of our professions, they work in an advisory board structure. This is true for occupational therapists. It's true for massage. It used to be true for massage therapists. It's true for X-ray techs. And so they have their own group that kind of can go over and recommend regulations, a bunch of experts, and then but then they're part of a larger board. In this case, that's the Board of Social Work.
Thank you. Delegate Adams.
Good morning. I was hoping that you could speak to a specific objective or outcome unique to a music therapist that would require such licensure. Just to give an example.
Could I ask a clarifying question as far as evidence to support the use of music therapy, or?
So in the idea that you would have a special licensure, I would imagine that there would be objectives that or outcomes that you're looking to achieve. And so I was just looking for an example of what would be. So as a clinician, we have clinical outcomes that we hope to achieve. So as a music therapist, licensed therapist, what would be a differentiating specialty objective that would require such licensure?
So we already have clinical objectives in place through our certification board, through music therapists and standards of education and clinical practice. So we conduct assessments. They're functional assessments. They're not diagnostic assessments for someone's level of functioning. So, for example, I work with people in neurology to improve their speech using music as the primary or the essential modality, using music to help with skills like memory, attention, executive functions, using rhythm strategically to help them improve their stride length in their gait. As far as specific objectives, as far as licensure and regulation is concerned, the issue that I touched on at the beginning was that because the state isn't regulating music therapy currently, it is up to anyone to decide who is qualified to practice music therapy. So, for example, currently on some students' IEPs, music therapists have been substituted with just having music-based activities conducted by teachers, even other professionals, other educators who said that they don't feel qualified to provide some of those. And that's currently being offered in place of a clinical intervention. So that would be analogous to saying that the Phy-Ed teacher is now going to perform physical therapy, or the drama coach is now going to perform speech therapy.
Excellent. Thank you so much. That's very clarifying.
Thank you, Mr. Chair. My question for the patron would be, could you talk a little bit about how this would affect the current workforce, where you might have people who are musical therapists either in a hospital setting or a school setting, and once licensure is required, is there a transition period so that people can continue practicing? Because I think the lines that Delegate Aird had pointed out, you can't practice as a musical therapist until you have a license. Thank you.
Well, yes, and part of the purpose of the substitute as well was to sort of clarify that you can't require someone to be licensed to be on the board until a license already exists. There has to be some sort of a transition period once this goes into effect, and again, part of that I anticipate will be covered, and Dr. Brown may want to validate that, but I would assume that transition periods like this, as they have been in other areas where we've created licensure, there has to be a transition period in the promulgation of regs that you're required now, and so we're going to put this into a place. You've got to have regulation. There has to be some time to flow that in. So I think that will be covered as we go through that process. Dr. Brown, we would concur with that. So.
I see no request to speak. Buttons are turned on. So the committee operates by motion. You got a motion? Is there a second? Okay, the HB 1562, the substitute to HB 1562 is before us. All in favor shall vote that way on the electronic device. Everybody's here. The bill reports 22 to nothing.
Thank you, Mr. Chairman.
Thank you, Delegate Head. Delegate Watts.
Thank you very much, Mr. Chairman. The bill before you is House Bill 552. Is it practice that I can ask for something to be distributed? Thank you. The bill before you addresses the issue of criminalization of birth control, and it simply states that in 18.2, which is the criminal code, that abortion would not include FDA-approved birth control. I stand before you in a long line of women that have introduced this identical bill since 2003. It's now 18 years. The very fact that it has not passed, I think, underscores its need. The piece that I have passed out to you is a copy of a handout that I received of 2 different years in front of the GAB office building. And it really addresses the issue before you. There is a philosophy that says that any birth control, and you can see IUD, the pill, etc., can operate as an abortion. This is under the definition, then, that life begins the moment that egg and sperm meet, not the medical definition that even that conception starts a good week, if not longer, later when the fertilized egg implants. Just as a side point, many fertilized eggs, as they begin to divide, there's a major problem in the lineup of the division of cells, and they self-abort. They are not viable. So that this then is addressing that time when you have, if you have that extremely narrow definition, this addresses the time to make sure that in any law that is interpreted, under our criminal code that we are not sweeping in the birth control approved by FDA. And again, as you can see in the article, it is very inclusive of what is normally used by the vast majority. In fact, I would say approximately 97% of our population uses one form of these birth control that is addressed in this article as being an abortant. And again, many women have carried this bill. I've had it for about the last 4 or 5 years, and the very fact that it has never passed, I think, underscores the need for this clarity.
Thank you, Delegate Watts. Are there any questions from the committee for the delegate? Are there any? Well, Mr. Chairman, I am Mr. Chairman. I'm so used to saying that. I would like to give the audience, anyone in the audience that has a comment on this legislation, a chance, if they want to oppose it or support it, to come to the microphone at this point.
Good morning, members of the committee, Mr. Chairman, and my fellow Virginians. My name is Jackie Gonzalez. I'm with the Family Foundation, and we're here to oppose the bill. Let's just be clear from the onset that we're not here to oppose birth control. However, there is something that we would like to highlight, and it's in the definition of birth control that is proposed in this bill, or the way that the bill is worded. It does create some interpretation challenges. First, the definition of contraceptive is a method serving to prevent pregnancy, and I know Delegate Watts alluded to that. But if you look at the FDA-approved birth control chart, which the bill says that birth control will mean contraceptive methods that are approved by the U.S. Food and Drug Administration, if you look at their chart, the chart includes emergency contraception listed on that chart, notwithstanding the FDA's own warning stating that it should not be used as a regular form of birth control. And they give two examples, ulipristal acetate, for example, which can be swallowed up to 5 days after intercourse, meaning that it can sometimes end a pregnancy. Again, contradicting the definition of contraception. The science is obviously, I think we would dispute and say fertilization is, in no other situation of any kind of life do we assume that conception takes place long after fertilization, except just when we want to advance so-called abortion rights. So I would say that words mean something, and so we would urge you to oppose this bill for the fact that it could end pregnancies. Thank you.
Good morning. My name is Kelsey Wilkinson. I'm from the Medical Society of Virginia, and I just wanted to speak today in support of the bill.
Delegate Price, who withdrew her request to speak. Are there any further questions of the patron? Are we ready to vote? There's a motion to report. There's a second. All in favor shall vote aye on the electronic device. The bill reports on a vote of 13-7. Thank you, Delegate Watts.
Thank you very much.
And I'm going to take one more bill and then move to the committee reports. I see one more patron out there, Delegate Simons.
Mr. Chairman. Thank you. HB 310, the Alzheimer's Board. would continue the important work of this board. There are an estimated 150,000 adults age 65 or older currently living with Alzheimer's in Virginia, and this number is expected to rise to 190,000 by 2025. Alzheimer's disease is the sixth leading cause of death in the United States and the only one of the top 10 that has no prevention, no treatment, and no cure. HB 310 amends the Code of Virginia to extend the sunset provision of the Alzheimer's Disease and Related Disorders Commission from July 1st, 2020 to July 1st, 2023. The bill will extend the important work of this commission, which was first formed in Virginia in 1982, and which advises the governor and the General Assembly on policy, funding, regulatory, and other issues related to persons suffering from Alzheimer's disease and related disorders and their caregivers. I come before you to ask that HB 310 be reported so that the citizens of the Commonwealth continue to have a voice in Alzheimer's policy. Thank you.
Thank you. Any committee members have a question for the patron? Are there members of the audience who oppose extending this deadline and keeping this commission going? There's a motion to report in a second. All in favor, press the yay button. If you're opposed, press the nay button. And your bill reports 19-0.
Thank you, Mr. Chair.
You're welcome. So now we're going to turn to our first committee report.
It starts on page 3.
Starts on page 3 of your docket in front of you.
It's health professions.
Delegate Adams, can you proceed with your committee report and take each bill, explain each bill to us?
Thank you, Mr. Chairman, members of the committee. The first bill is House Bill 115. The patron is Delegate Hope, which reported out 6-0. This is programs to address career fatigue and wellness in certain healthcare providers' civil immunity. This expands civil immunity for healthcare professionals serving as members of or consultants to entities that function primarily to review, evaluate, or make recommendations related to healthcare services, to include healthcare professionals serving as members of or consultants to entities that function primarily to address issues related to career fatigue and wellness in healthcare professions licensed to practice medicine or osteopathic medicine or licensed as a physician assistant. This bill also clarifies that absent evidence indicating a reasonable probability that a healthcare professional who is a participant in a professional program to address issues related to career fatigue or wellness is not competent to continue in practice or is in danger to himself, his patients, or the public participation in such a professional program does not trigger the requirement that the healthcare professional be reported to the Department of Health Professions. The bill contains an emergency clause.
And you move the...
There's no limits on this one.
No,
It's a street.
but we have to vote on
Delegate Adams.
I move to report, sorry.
the vote in subcommittee was,
It reported out 6-0.
and you so move.
So move.
Is there a second? Is there anybody, any questions for Delegate Hope? Okay, there's a motion and a second. All in favor, please vote aye.
If I'm just second. I mean, it's easier this to
The bill is reported 19-0. Delegate Adams.
HB 165, also patron Delegate Hope, defines teledentistry and establishes requirements for the practice of teledentistry, establishes requirements for taking of dental scans for the use of teledentistry by dental scan technicians, and clarifies requirements related to the use of digital work for dental appliances in the practice of dentistry. It reported with substitute 5-1. I move to report the substitute.
Mr. Chairman,
Delegate Hope.
I'd ask that the committee reject the subcommittee substitute, because we do have a substitute.
Is there a second to reject?
Second.
Okay, all in favor, say aye.
Aye.
Okay, Delegate Hope.
The substitute that you have before you is a compromise between all stakeholders and all parties. The bill still does what the delegate said it does, but it just has some extra precautions in there. I don't know if Scott Johnson is here. If Scott, do you want to just describe a little bit about the agreement that was reached?
Yes, sir,
That's
Mr. Chairman.
contained in the substitute.
Mr. Johnson.
Good morning, Mr. Chairman, members of the committee. Scott Johnson, General Counsel for the Virginia Dental Association. The substitute still addresses the main issue, and that is Virginia doesn't have any regulations or statutes on teledentistry, and so it is an attempt to codify best practices as we go through this. The first thing that largely the substitute does is on page 2, line 45, it establishes a definition of what is teledentistry. And today, there's no requirement that teledentistry be provided by somebody licensed by our Board of Medicine, whether you're at the over at the VCU School of Dentistry or anywhere else in the state. So this bill will require that it be a Virginia licensed dentist doing this. We also have in here a definition of what is a dental scan, because that's important for that. This bill does not create any new licensing. So today, under this bill, on the top of page 3, we...
Could you
Delegate
ask the
Bell.
witness to identify what is different than what came out of subcommittee? And if he's doing that, then I apologize. I just didn't hear that at the
I
beginning.
think
but
that's
there's-
what he's doing, Delegate Bell, but
Yes, sir, Mr. Chairman.
so you can tell.
Delegate Bell, in subcommittee, we had two terms defined in this bill when we were trying to build the definition of teledentistry, and it was called asynchronous and synchronous. Synchronous being real-time communication, asynchronous meaning moving information when it's not in real time. Those words are not commonly used, and so we got rid of them, and we tried to go with a definition of teledentistry in here that is more streamlined. The other big change from subcommittee to jump forward is basically, if you look on line 3, page 72, we built out what is required to establish a dentist-patient relationship through teledentistry.
Delegate Bell.
I'm sorry. I'm just trying to follow.
Page 3.
Page 3.
Got it.
Not that way.
So, Mr. Chairman, on page 3, paragraph B, we build out what it takes to establish a bona fide dentist-patient relationship. We borrowed language that y'all passed in code back in 2017 in large part to do this, recognizing some of the technologies, recognizing the need that we have the ability to establish an examination on that. The other thing I would draw your attention to that remains in the bill is on page 4, line 100. I refer to this as the standard of care paragraph. It basically says the same standard of care in the brick and mortar dentist office will be the same standard of care in teledentistry. And if you need to order x-rays or you need to do more physical exam and the standard requires that, you've got to do it. And if you don't, now the Board of Dentistry will be able to call somebody in and hold them accountable. The bottom of page 4, paragraph E, establishes what I refer to as the wellness paragraph. If we're trying to encourage people to go get an annual dental exam, we say if you've got a dentist of record and you're being treated through teledentistry and the teledentist doctor realizes, hey, this person hadn't been in and had their teeth cleaned, you want to encourage them to say you need to schedule an appointment with your regular dentist. And if you don't have a dentist of record, you want the teledentistry dentist to say, hey, here's some names or referral sources of where you can establish a relationship. So that was added in that piece of it. The only other change, Mr. Chairman, I just cite to you is on page 5. This is the statute that governs how most dentists will use a lab or a third party to build whatever aligners, retainers, whatever they're going to use to move your teeth. And around line 14, we clarified that when you place the order today and those aligners come back, they're given to the patient, they put in their mouth, and the dentist looks to make sure that they got what they ordered and what they ordered is in fact working, and that's going to be required of teledentistry as well. Mr. Chairman, I'm glad to answer any other questions, but those are the primary changes.
Scott, can you tell us why this bill is needed in Virginia?
Yes, sir, Mr. Chairman. As I mentioned, the Board of Dentistry some years back just issued a guidance document on teledentistry, and in large part, they robbed the definition of telemedicine and sort of just changed the words around teledentistry. A guidance document has no effective law, so nobody can be called really before the Board of Dentistry today and says you violated a statute, because they don't have any statutes, y'all haven't passed any, and they don't have any regulations. So by putting this in place, we give a codification of best practices and rules of the road so everybody knows how to do that, and the Board of Dentistry can carry out their duty, which is protecting the public.
Delegate Hope.
Mr. Chairman, I move that the committee adopt the substitute.
Is there a second?
Second.
So by acclamation, the substitute is agreed to. Delegate Adams.
Thank you, Mr. Chairman. Scott, can I just summarize some of the changes to make sure that I understand? What we had discussed in subcommittee essentially was ensuring that prior to any contracting a teledental type entity preparing implants or an appliance of any kind and x-rays, that there would be some visualization by a dentist, whether in real time or their personal dentist, what have you. Is that so far correct, what happened?
Mr. Chairman, Delegate Adams, that's correct.
And then does it also say now that the patient would need to circle back with some type of dentist once they receive an appliance to see if in fact it is fitting appropriately? And if that is what it's saying, which type of dentist is that requiring?
Mr. Chairman, Delegate Adams, the two places in the bill, if you look at paragraph C on page 4, that talks about all of the necessary referrals in line 91 in particular. So we have addressed that two ways. One, if the aligners are not moving the teeth appropriately, and that requires a referral to an orthodontist in brick and mortars, that would be required. If in monitoring the movement of those teeth, for example, the dentist through teledentistry saw a cancerous lesion in the lip that they had not seen, that would require perhaps a referral to someone else, like an oral surgeon or something like that. So the referral requirement is there. And then globally, the standard of care, if the standard says you have to refer somebody, then you still have to do it under teledentistry.
Follow-up question, Mr. Chairman. So again, just to be clear, if the appliance is being managed by the outlet that supplied the device and everything is going well, there's no need for the patient to have to circle back to make a secondary dentist appointment?
Correct in here. The only requirement to go back is if they've not had a teeth cleaning, a wellness, then the dentist through teledentistry needs to say, hey, you're encouraged to schedule up with your dentist of record, or if you don't have one, here's a list of places you may want to go, either dentist or clinic.
Follow-up question.
Delegate Adams.
But that's a recommendation, not a mandate.
Correct.
Thank you, sir.
Thank you. There's a motion and a second on the floor. Delegate Hope, do you want to sum up here?
I just want to say this is really groundbreaking, what we're doing here. This could serve as a model for the rest of the country. I want to thank all the stakeholders for coming together and putting this in place. I think it's obviously I'm biased, but I think it's an exceptional bill, and I look forward to its passage. Thank you, Mr. Chairman.
Thank you. So there's been a motion and a second. Any further discussion? Members will vote on the electronic voting board. On the substitute. The bill passes on a vote of 19-0. Delegate Adams.
Mr. Chairman, members of the committee, House Bill 517. The patron is Delegate Bulova. This is collaborative practice agreements, nurse practitioners and physician assistants. This adds nurse practitioners and physician assistants to the list of healthcare practitioners who shall not be required to participate in a collaborative agreement with a pharmacist and his designated alternate pharmacist, regardless of whether a professional business entity on behalf of which the person is authorized to act enters into a collaborative agreement with a pharmacist and his designated alternate pharmacist. This bill is a recommendation of the Joint Commission on Healthcare and reported with Amendment 6-0. And I so move.
Members of the committee, there was a line item adopted in subcommittee that the council is going to read.
This line amendment has been distributed to the members for the audience. The line amendment is on line 20 after working, Strike the remainder of line 20 and through podiatry on line 21, and insert in accordance with the provisions of 54.1-2951.1. So that sentence will read, Romanet 3, any licensed physician assistant working in accordance with the provisions of section 54.1-2951.1.
Is there anyone in the audience that would like to speak to the bill, even though it's been heard thoroughly in subcommittee? And the line amendment has already been adopted in subcommittee. Do we have a motion on the bill?
Move to report.
There's a motion to report and with amendment, and it's been seconded. All in favor shall vote in accordance with it. The bill reports 19-0. Delegate Adams.
Mr. Chairman, members of the committee, HB 648, patron is Delegate Hurst. This is a prescription monitoring program, information disclosed to the emergency department, information exchange and redisclosure. This provides for the mutual exchange of information between the prescription monitoring program and the emergency department information exchange, and clarifies that nothing shall prohibit the redisclosure of confidential information from the prescription monitoring program or any data or reports produced by the prescription monitoring program disclosed to the emergency department information exchange to the prescriber in the electronic report generated by the emergency information exchange, so long as the electronic report complies with relevant federal law and regulations governing privacy of health information. This reported out 6-0. And I so move.
Is there a second?
Second.
Is there any discussion on the bill? Is there anyone in the audience who would like to speak to Delegate Hurst's bill 648? So, you ready to vote? HB 648 passes by vote of 20-0. Delegate Adams.
Thank you, Mr. Chairman. Members of the committee, House Bill 860, patron by Delegate Bell, professional use by practitioners, administration of inhaled asthma medication. This reported out with a substitute. Mr. Chairman, would you like me to read first, or?
We also have additional line amendments to the substitute that council can read.
Move the substitute.
Second.
The substitute's before us. Here's, Sarah will read the line amendments to the substitute.
Okay, there are 4 additional line amendments to the substitute that are essentially technical. The first line amendment is on line 280. After the word administer, strike undesignated stock and insert the word "an." So that
That's
will read-
A-N, not A-N-D.
Yes, A-N. So that will read, may possess or administer an albuterol. And then the second amendment, line 280, after albuterol, strike the word inhalers and insert inhaler in the singular. So again, that will read, may possess or administer an albuterol inhaler. We'll make the same 2 amendments on line 287, replacing undesignated stock with the word "an," and replacing inhalers in the multiple with inhaler in the singular.
Delegate Bell, do you have any comments on the substitute or the
Not-
bill in general?
Well, I like the bill, and it's to enable school nurses and personnel to administer the albuterol inhalers in the way that they already administer the EpiPen. The line amendments that are technical came from the Board of Pharmacy after they thought about it after the subcommittee hearing and said that there's some terminological differences they'd like to have. I would ask that the committee pass the bill.
Anybody
Move
have
the
any
amendments.
questions on the bill? I think the amendment's been moved. Okay, this motion to report, and it's been seconded. All in favor of 860, please vote on the electronic voting device.
And it will put these amendments into the substitute. There'll be one substitute coming out.
There will be one substitute coming out of this committee for the floor. Delegate Adams.
Mr. Chairman, members of the committee, HB 1000, patron is Delegate Hope. This is prescription drugs and expedited partner therapy. This eliminates the requirement that there exists a bona fide practitioner-patient relationship with a contact patient for a practitioner to prescribe expedited partner therapy consistent with the recommendations for the Centers of Disease Control and Prevention. A pharmacist dispensing a Schedule 3 through Schedule 6 drug to a contact whose name and address are unavailable shall affix expedited partner therapy or EPT to the written prescription in the label. The bill repeals the July 1st, 2020 sunset on the provision that allows practitioners employed by the Department of Health to prescribe antibiotic therapy to the sexual partner of a patient diagnosed with a sexually transmitted disease without the physical examination normally required. This bill reported out 6-0, and I so move.
Is there a second? The bill has been moved and seconded. Delegate Hope, do you have any comments on your good bill here? Okay, anybody from the audience like to speak on HB 1000? Anybody from the committee? So please vote your conscience on the electronic voting device. Delegate Adams, your
Mr.
last
Chair-
bill.
Yes, sir. Mr. Chairman, members of the committee, HB 1013, patron is Delegate Herring, prescription requirements, treating of sexually transmitted disease sunset. This bill repeals the sunset of the July 1, 2020 on the provision that allows practitioners employed by the Department of Health to prescribe antibiotic therapy to the sexual partner of a patient diagnosed with a sexually transmitted disease without the physical examination normally required. This bill reported out 6-0, and I so move.
Bill's moved and second. Is there any discussion of the bill? All in favor of the bill, please vote on the electronic voting machine. And the bill reports 18-0. Thank you, Delegate Adams, for
Thank
your
you,
good
Mr.
work.
Chairman.
When does your committee meet again? For the audience, subcommittee? Thursday night.
Thursday
This
night at
Thursday
5
night.
p.m.
So
in the
that,
Capitol Room, House Room 1.
nobody in the audience, please miss this. Very exciting. Very
It's the
exciting
best.
subcommittee. Delegate Guzman with the Social Services Subcommittee.
Thank you, Mr. Chairman. House Bill 637 from Delegate Samira reported 5-1. It's about child support reasonable cost for health care coverage, modifies the definition of reasonable cost for purposes of health care coverage in child support arrangements by capping the maximum amount to 5% of the gross income of the parent responsible for providing health care coverage. Under current law, such costs are capped at 5% of the parent's combined gross income. So move.
Everybody understand the bill? Okay. Delegate Orrock.
Yeah, Mr. Chairman, if I understand the measure, current law stipulates that the combined income of the parents are the trigger. And with this changed under the language we have now, it would allow a traditional family unit to where, say, the husband is a millionaire and the mom is a stay-at-home mom.
Doesn't change that.
That by now saying if mom claims she is solely responsible, or the one responsible for the child's health care, then only her income resources would act as the trigger. I think I understand the intent of the legislation is to speak to those circumstances, let's say where that you have a divorce situation and the non-custodial parent is supposed to be providing resources but is not. And I think I've got language that may address that. If at the appropriate time, Mr. Chairman, I'd propose some amendments that I think will address both circumstances that I raised.
Okay, can you hold that for just a
Yep.
second? Do we have someone from Social Services who can speak to the bill? Please introduce yourself.
Good morning, Mr. Chairman. I'm Alice Burlinson with the Division of Child Support Enforcement and members of the committee. Right now, with child support calculations, health care coverage, whichever parent is providing it, is part of the child support calculation. It gets added into the child support guideline along also with daycare. Under the current law, the limit is 5% of the combined gross income of the parents. This change would limit it to 5% of the income of the parent providing the insurance rather than combined. This is to track federal regulation that was changed in December of 2016 to limit it to the income of the parent providing it. But whichever parent is providing it, it is included in the calculation, and the parents do share the child support obligation based on the percentage of their incomes of the total.
Can you hang there for a second?
Sure.
Delegate Orrock, can you explain your amendment, and maybe she can
Well,
help
my
us with that?
concern, my concern, Mr. Chairman, is I'm fearful we may go too broadly. And I guess, would we address the federal changes if we put the parents' combined gross income provision back, but after income inserted the word or, and after the word parent inserted the word solely? So clearly, if the parent is the one solely responsible for providing health care coverage, it would only be their specific income. But if it is a shared circumstance, then both would still count towards meeting the trigger dollar amount.
Okay. The way child support guidelines are calculated now is the gross income of both parents are combined. And then you look up at it on a table at 20-108.2 and see what the base amount is for one child at that parent, at the two parents' combined gross income amount. The cost of the health care coverage, whoever is providing it, is added to that amount. So whichever parent is providing it, it's added into the total, but what they pay at the bottom for the total child support is shared based on their prorated income of the total.
Delegate Orrock, does that explanation?
Yeah, I'm not going to offer my amendments, Mr. Chairman. I'm not sure they do any harm, but I don't mean to do any harm, so I'll leave it alone.
So, okay, thank you, Delegate Orrock. So if we determine that there's needs to be another technical fix on this, we can address it in the process going forward. Thank you, Ms.
Mr.
Burleson.
Chair,
Do you, yeah,
Sure.
Delegate Bell.
I've got my,
Yep, sorry about that.
I have some substantive questions I can ask the patron, or I can ask the gentlelady at the podium.
The patron.
I'm happy to
ready
ask.
answer
I want her to
question?
walk away if she's the one who needs.
I think Ms.
Chair,
Burleson
I have a
has a
question.
subject matter expertise, but we're happy to have the delegate
That's fine.
answer the questions.
I just don't want her to leave.
I don't want her to leave either.
Mr. Chair.
You can't leave.
May I ask the witness a question?
We could give you a cup of water if you want some.
I'm good, thank
Okay.
you.
I think some examples would be helpful to some of us where this is not our issue of where we have a lot of expertise. So if you have the first spouse makes let's just pick a number that's easy to do math. So $50,000 and the other spouse makes $0. And then the second case, they both make $50,000. Could you walk us through what the current law is and how this would change
Sure.
it?
The current law is if one spouse makes 50 and the other makes 0, if health care is available from either parent's employer or union or group, and under this situation, we would assume that the parent making $50,000 has health care available. So let's say it's $500 a month. So whatever the guideline table says for parents who together make $50,000, let's just, I don't know what that number is off the top of my head, but let's just say it's $2,000 a month, and the health care is $500. So the total child support obligation under that situation would be $2,500, the $2,000 from the table and the $500 for the health. So that would be split at the bottom based on the parent's prorated income. So the $50,000 earner would pay $2,500, and the other parent would pay 0. Except under the law, there's a minimum amount of $68 for one child. So no parent actually would get an obligation of 0. In the situation where each parent makes $50,000, that amount that had been $2,000 would now probably be roughly, for the sake of argument, $4,000 for the child. You'd add the $500 for health insurance, so that would be $4,500. But then at the bottom, since their incomes were the same, you would split the $4,500 and each parent would pay $2,250. Did those examples help, Delegate Bell?
Mr. Chair, then I guess I'm still not sure how this, okay, so I think I understand what you just said, but the bill would, it changes the caps. Okay, I guess, then what does this bill do to change that, or how does this impact what you just said?
Okay. Right now, the current law, reasonable cost is defined as it's not to exceed 5% of the both parents' gross income. The bill would change it to track federal regulation to say it would only be 5% of the parent's gross income who's providing insurance.
So, Mr. Chair, if I get it, and
Delegate Bell.
everybody's ahead of me, that's fine, but I'm not. So 5% of 50 is $2,500, 5% of 100 is 5,000. Is that?
Right.
Okay, this big picture, okay.
Right. So
That's-
if the insurance that was available for the $50,000 earner when the other parent made zero, let's say the insurance was $5,000, that would not be considered available at a reasonable cost because it would exceed 5% of that person's gross income.
Okay, Mr. Chair.
Yeah, Delegate Bell.
And then what? What happens? I'm still missing I'm sure this means something that you think we know, and at least I don't. So then,
The
I know.
the determination is made that health insurance is not available at a reasonable cost, and it wouldn't be put in the child support calculation, and neither parent would be responsible for providing health insurance. And while we used very large incomes, this really factors in much more at the lowest income levels. It's not really for people who make $50,000 or $100,000 a year. It's really for people who make $10,000 or $12,000 or $15,000 a year each, and still a very low income if they each make about the same amount.
Okay, and so.
Delegate Bell.
I feel like believe me, we don't know. I've got no end to this questioning. I just don't know the answer. So then, if it isn't calculated in, does that mean they qualify differently, or there's some other, in other words, to read just the words, it would seem like we're saying that there's less money to go to the kids because we're capping it at a lower level. I doubt that's what the ultimate impact is.
No, the
I don't
ultimate
know what the ultimate
the
impact
ultimate goal is to have health insurance be a smaller part of the total amount of money that goes to the kids. So for a low-income person, let's say you got to the bottom of the calculation and it was $500 that the non-custodial parent or the non-custodial parent had to pay. Well, if his health insurance cost is $400, that means only $100 of child support is actually going to the other parent for the support of the child. The goal is to have health insurance cost as little as possible so that the more cash can go to the family to support the child.
I think that's
Ms. Burleson, are you,
Yes,
are you
sir.
Dr. Burleson?
Yeah.
Burleson.
No,
Okay, Ms. Burleson. I have Delegate Samir wants to comment on this or ask a question.
Yeah, Mr. Chair, thank you so much. To the delegates that are asking about the bill, idea is that lower income parents should not be overburdened by health insurance costs. We're trying to make sure that the parent that is capable of paying of the family, that they are not having to be taking the burden of the entire family in this cost on this 5% of the entirety of the family's income category that we have now. We're trying to split that so that it doesn't overburden individuals and parents specifically, sorry, and so that they can spend more money on all the other aspects of family life. Thank you.
Thank you, Delegate Dem. Ms. Burleson, what would happen if we didn't make this change? I mean, do we have to do this because of federal money coming down to us?
I don't think we have to do it. I think we would like to do it because it would focus child support and the cash part of child support and getting to the children that is meant to support, and not a large amount would be taken up with provision of health care.
Okay,
coverage.
that's the purpose of the bill. So do we all kind of mostly understand it now? I'm sorry, we got Delegate Adams is and then Delegate Ora.
Thank you, Mr. Chair. My question is, I'm really struggling to understand like how this is operationalized. Is the end goal somehow that it allows? So I imagine that you want to ultimately benefit the child, and so is this to make it so that they would be more likely to qualify for Medicaid coverage? I'm just trying to understand like how is this operationalized in a way that's helping? I get that. You want to reduce the cost and the burden of health insurance within the family budget, however that is structured.
It could potentially provide for more families to be able to be eligible for Medicaid or for FAMUS, the low earner health care coverage.
Follow-up question, Mr. Chairman.
Adams.
So does this somehow, in the way this is structured, then carve out the ability for the income to be potentially lowered so that they meet the threshold for Medicaid coverage? I'm just still struggling to understand how it's operationalized in a way that helps the
It's
child.
not going to change anyone's income. Right now, the income for child support purposes is gross income for both parents. So you start with gross income, so it's not going to change. The focus is going to put, as Delegate Samira said, the focus is going to put more cash going to the families and less money in that total child support obligation being used to provide health care insurance, health care coverage.
Follow-up question, Mr. Chairman.
Adams.
So where is the insurance coming from, and how does it become less costly?
Okay, the insurance right now, if you start at line 80 of the bill, reasonable cost has been in the Code of Virginia since at least 1997. It was redefined in 2002 and then again in 2009, most recently the definition of 5%. But if you go into line 82 in the existing language, this reasonable cost health care coverage is coverage that would be available through employers, unions, or other groups, or department-sponsored health care coverage without regard to service delivery mechanism. So that's not Medicaid, but it does include FAMUS, and a lot of these lower income families are eligible for either FAMUS or Medicaid.
Thank you.
Delegate Auroch and then Delegate Levine.
Yeah, Mr. Chairman, and at the end of the day, does this create a circumstance whereby children are not going to be receiving the same level of health care insurance coverage as they currently have under law?
I don't believe so. Do we have?
Follow up.
Yeah,
Delegate all due respect, ma'am, to say I don't believe so doesn't give me great comfort.
Delegate Auroch, maybe somebody could tell us the eligibility requirements for FAMUS, but I think they're FAMUS is developed for parents that don't qualify for Medicaid but are still relatively low income. So the probability that they'd be eligible for FAMUS is really high in these cases, and that means that someone will be paying an insurance bill they don't need to pay because they're eligible for Medicaid. These are in low-income situations.
Right, and also with low-income families, most of those people do not have health insurance available through employers, unions, or other groups.
Yeah.
All right.
Okay.
Follow up, Mr. Chairman?
Yeah. Delegate Auroch.
But what about in non-low-income families? At the end of the day, and understand this is written to the child support section of code.
Right.
I don't want to, by inadvertent consequence, pass something here that's going to diminish the health care coverage of any child, regardless of the parent's overall income. And
Understood.
I would just feel that's the root of my question. Yeah. I understand in the context where we're talking about child support, but
Yes,
I don't
sir.
want to, by inadvertent consequence, do something untoward to the kids' health care coverage.
Delegate Levine.
Thank you, Mr. Chairman. I guess my questions are in the same vein of Delegates Bell, Adams, and Norick. And so it helps me just to have a hypothetical. The custodial parent makes $100,000 a year. The non-custodial parent makes, we'll just do a very low number, $1,000 a year. And the non-custodial parent has to pay some measure of child support. So let's say the court orders them to pay $100 a month. Again, probably too high, but whatever it is, as I understand the bill, and the non-custodial parent provides health care as well.
Right.
So the non-custodial parent, since they only make $1,000 a year, only has to pay $50 once this is changed. Before then, the non-custodial parent would have to pay hundreds of thousands of dollars they don't have, whatever, 5% of the combined income could be 10,000.
When the council here says the non-custodial parent doesn't pay at all, can we just have her?
Alice, may I
Thank you,
walk this?
Sarah.
Will you help me make sure
No.
I am explaining this
Sure.
properly? So we are talking about a case where you have a custodial parent and a non-custodial parent. The non-custodial parent goes through the process, a determination is made about what support the non-custodial parent owes the custodial parent for that child. Part of the support that the non-custodial parent will owe, some of it is cash, some of it may be, and in the cases we're talking about is healthcare coverage. We're talking about health insurance when we say coverage. We're not talking about all the other incidental healthcare costs. We are talking about health insurance. There are several ways that non-custodial parent will be able to provide that healthcare coverage. They may have it through an employer. They may buy it on the open market. However anybody would obtain health insurance, those are the options. When looking at what that parent, non-custodial parent, is going to have to pay for health insurance, currently the court will take into account the income of both parents and cap the amount that they may have to pay at 5% of the combined income. If it exceeds 5%, the cost will exceed 5% of the combined income, that child will generally be eligible for FAMUS, which means they will receive their health care coverage not through the non-custodial parent, but rather through FAMUS. This bill will shift the total amount that the non-custodial parent may have to pay for health care coverage, insurance, for that child. Instead of having to pay an amount that is equal to 5% of the non-custodial parent's income plus the custodial parent's income, it will now be limited to 5% of the non-custodial parent's income, which means in determining what constitutes reasonable, the court will only look at the non-custodial parent's income. That amount then may be lower. What constitutes a reasonable amount will be lower under this new bill than it would be under the current law. So when that amount that they would have to pay for health insurance for the child that is living with the custodial parent exceeds 5% of their income, it will no longer be reasonable. They will no longer have to pay that amount as part of what they pay for child support, but rather health insurance will be available through FAMUS, so that instead of having all of that amount they pay for child support going to health insurance, it's actually going to the other parent as cash to support the child. So it reduces the point at which the courts will say, non-custodial parent, you have to pay this amount for health care and the remainder of your obligation is cash, so that more cash will go to the custodial parent and less will go to the cost of health insurance. Children won't lose health care coverage. It will just come from a different source, which would be once it exceeds 5% of the non-custodial parent's income, it will come through FAMUS in those cases because these are lower income families.
Thank you, Sarah. That was a much better explanation than I think I was able to give, and I appreciate it.
Delegate Levine, would you want to follow up on that, or is that answer your question?
Actually, I really thank Sarah for explaining that. As I understand it, I'm just put a cap on it. What it means is if someone doesn't make enough money and they're providing child support, but they don't make enough money to buy the full health care coverage that the child needs, the child can go to public assistance, get the same health care they would before, and the other parent gets more money in child support, take care of the child. So the child is equally well off with health care, gets more money with child support. The child is always better off under this arrangement.
Ms. Burleson, do you agree with that?
Yes, I do. Thank you,
Okay,
Delegate.
I get it now. Thank you.
Delegate Samira.
Mr. Chair, thank you. I don't want to underestimate the point that Delegate O'Rourke was making is, does it hurt higher income families? No, it doesn't. It puts a cap similarly on them as well. And if you're making a high income and it's a cap on $5,000, that's a pretty high cap right there. I'd say the large majority of children fall underneath that 5% cap for a higher income family.
Right,
Okay.
and I would just like to add that child support is calculated based on gross monthly income. So 5% of $1,000 a month is a whole lot more to a person or a parent that makes $1,000 a month than 5% is to somebody that makes $5,000 or $10,000 a month.
Point taken. Delegate Head.
Thank you, Mr. Chairman. Just I'm really trying. I thought I had this thing down until we got the explanation, and this is my concern with it. If the non-custodial parent is the one that's paying the bill, and you've got a custodial parent, and you're going to say that they're going to qualify for FAMUS, where does that calculation come in for any of the income from the custodial parent? Because if you've got a situation where the custodial parent has a much higher income than the non-custodial parent, but you're basing this solely on the income of the non-custodial parent who's responsible for paying the bill here, you could end up with the person who makes $25,000 a year being responsible for at least a portion of the, of something, and if it doesn't cover the cost, then now they qualify for FAMUS, even though the child is living in a home that has a very, very high income, and we're no longer taking that into consideration. I'm lost in the murk here of I mean, this is really muddy water all the time anyway, and it's, but I really am very concerned now.
Okay, so let me explain. The way child support is calculated in Virginia, the first thing you do is you start with the gross income of both parents. And you start with that figure, and then you look at the table at 20-108.2, and it tells you based on, let's say both parents make $1,000 a month, if we're talking low-income people. So for $2,000 a month, you look it up on the table, and it says maybe child support for one child is $200. So if there's no health insurance available at the bottom, the total amount is $200. But both parents share that equally. The non-custodial parent would pay $100, and the custodial parent pays $100. Now, the custodial parent doesn't actually send the money out of his or her home to the division or to the other parent, but they're expected out of their $1,000 that they earn, that $100 of that, based on the child support calculation, is to go to the benefit or to the support of that child. So, so whatever the cost of the health care coverage is, that would get added in to that $200 at the bottom. So say
I got all that. My concern, Mr. Chairman, is that I'm not dealing with the low-income families here. I'm dealing with the higher-income families. Where do we make the distinction of whether they could qualify for getting public assistance if there's a high income that goes on with that? Because what we don't want to set up is a situation where now all of a sudden we have said the non-custodial parent is going to be responsible for this. We're only going to base it on their income rather than the whole pie. To determine, and your explanation was this would determine whether they could then qualify for funds out of FAMUS because the non-custodial parent cannot afford to do it, when the custodial parent might very well be able to. And sometimes I know that the courts, and I don't know what our codes are. This really concerns me as to what we're going to do as far as triggering that. That's it. So you're giving me examples of the low income. I'm wanting you to give me examples of the higher income. There's got to be a threshold somewhere where the overall income of the two parents combined eliminates that as a possibility, I would think. Or maybe it doesn't. And because the other thing too is to Delegate Orrock's point, I don't want to put a situation where we've triggered something that in this war that gets going on, that we end up with a kid that gets no coverage.
Right. The child support guideline law says that if either parent has health care coverage available, it should be ordered by the court. So the threshold now is 5% of the total parent's income. Now, this bill would make it 5% of the parent providing the coverage. So I don't feel like I'm answering your question, Delegate Head. But if a mother has low income, but if a custodial parent has a low income and the non-custodial parent has a high income, but has health insurance available, he or she would only have to pay up to 5% of their gross income. But if that parent has high income and is paying child support on a regular basis and health insurance is available, the low-income parent would not be eligible for Medicaid or FAMUS if they're getting a significant amount of support into their household.
So if I can ask, so rich people are not going to get off the hook here for taking care of their children's health care?
No, not at all.
So this is not a get-out-of-jail-free car for deadbeat rich people?
No, Mr. Chairman, it is not.
All right. So there's been a motion to report, and it's been seconded. I know there's some questions out there still, but nobody has their request to speak button on. So I would, unless there's someone from the audience, anyone else from the audience that want to speak? Okay, I will. Let's, motion second. Please cast your vote. Wow, should have done this earlier. Man, wow.
All right, we got it.
Okay, well.
Thank you very much,
It was
Mr. Chairman.
confusing, but thank you so much, Ms. Burlinson, and I understand it better, and thank you for your service.
Sure, thank
And
you very
everyone in
much.
DSS, thank you. The bill reports 17 or something to nothing. 20 to nothing. So,
Number 2.
Delegate Guzman,
Thank you, Mr. Chairman. House Bill 69.
no more of those.
Okay. House Bill 690 from Delegate Earth has reported and referred to appropriations 5-1. It's about TANF and Family CAP repeals the prohibition on increasing the amount of temporary assistance for needy families, TANF, that a family receives upon the birth of a child during the period of TANF eligibility or during the period in which the family or adult recipient is ineligible for TANF benefits, pursuant to a penalty imposed by the Commissioner of Social Services for failure to comply with benefit eligibility or child support requirements, and so move.
Is there any questions for the bill? Sorry, the member shall vote on the electronic voting machine. That was too quick. That's it. No problem. It's quiet. Do you want it? Here we go. Very good. Thank you. Congratulations, Delegate Aird. We'll see you. We'll see you up on the 13th floor. Delegate Guzman.
Thank you, Mr. Chairman. House Bill 778 from Delegate Jones has reported 6-0. It talks about family assessments timeline, increases from 45 days to 60 days, the allowable time for completing a family assessment by a local Department of Social Services, and removes the local department's opportunity to request a 15-day extension, and so move.
For a second. Any discussion on the bill? All in favor, please vote on the. Delegate Guzman.
Thank you, Mr. Chairman. House Bill 904.
Sorry, I'm supposed to announce the vote. The vote was 20-0. Thank you. Delegate Guzman.
Thank you, Mr. Chairman. House Bill 904 from Delegate Hayes has reported 6-0. It talks about child abuse and neglect reporting, public sports programs, adds to the list of mandatory reporters of suspected child abuse and neglect, athletic coaches, directors, and other persons 18 years of age or older that are employed by or volunteering with a public sports organization or team, and so move.
So Delegate Hayes, correct me if I'm wrong, but this bill basically adds the public employees to a long list that was probably generated by Delegate Bell in the past of reporting. And so please cast your vote on the voting machine. The bill reports out 20-0. Delegate Guzman.
Thank you, Mr. Chairman. House Bill 1015 from Delegate Herring. I would like to move the amendment.
Council will read the amendment, please.
There's one line amendment to the bill. It has been distributed to the members. It's also available online. coming out of subcommittee. The line amendment is on line 38 after granted to. Strike the remainder of line 38 through delivery of on line 39 and insert an organization that provides. So the sentence will read, no less than 5% of the fund shall be granted to an organization that provides training and technical assistance to entities implementing prevention programs.
Is there a second? Okay, amendment is accepted without objection.
Thank you.
Any
Thank you,
discussion? Sir, go ahead. Delegate Guzman, you finished?
Yes. House Bill 1015 has been reported with an amendment and referred to appropriations 6-0.
Okay, the 1015 was reported with an amendment and referred to appropriations, and so that's the motion before us. If someone would make it. It's been moved and properly seconded. All in favor, please vote on the voting machine. Delegate, the bill reports and referred to appropriation on a vote of 20-0. Delegate Guzman.
Thank you, Mr. Chairman. House Bill 1137 from Delegate Lopez has reported 6-0. Talks about temporary assistance for needy families and Virginia Initiative for Education and Work Hardship Exception requires the Department of Social Services to keep records of the number of Virginia Initiative for Education and Work participants that receive an exception to the time limitations on temporary assistance for needy families due to hardship and the specific circumstances relied upon to grant such exceptions, and annually publish non-identifying statistics regarding such information. So move.
Is there a second? Second. So this bill basically is reporting, just an additional reporting requirement. Does anybody from Social Services want to speak to this? Duke? No? Okay. Bill's before us. Motion was moved and properly seconded. All in favor, please signify by voting on electronic voting machine. And the vote is 20 yeas and reports out with no negative votes. Delegate Guzman.
Thank you, Mr. Chairman. I understand the patron is here and who would like to offer a friendly amendment to his bill.
Delegate Keene, before you start, can Sarah explain where we are in the process here?
Exactly.
Okay. House Bill 1148 reported out of subcommittee with a set of 11 line amendments, most of which are technical in nature. They are available online at this time. After the subcommittee meeting, we were informed that a couple additional amendments were required. So there are 3 new line amendments, and I think the way we need to handle this is to accept amendments 1 through 6 and 8 through 11 and reject amendment 7, and then we can adopt the new amendments, and I will read them at that time. In addition to the amendments you just adopted, there are 3 additional amendments. I'll do the first 2 and then explain the third one.
Sarah, was there amendments that we need to delete?
Amendment number 7 out of subcommittee was the one that needed to be rejected.
Okay. Is there a motion to reject?
Point of order.
Yeah, the gentleman from Caroline.
Yeah, Mr. Chairman, I think parliamentarily, if we just don't take action on the subcommittee recommendation on those amendments, they can go away. If we feel we need to act on them, then the motion should be still in the affirmative to accept, but we would want to vote no.
Okay.
Whichever is the cleaner way for staff to clear what subcommittee did. Maybe the cleanest is to move on those amendments in a block, but then we would then vote to reject.
Okay.
I just know we want all of them except number 7.
We did move 7.
Okay. So,
I think that's correct. Okay, yeah.
so you currently have the 10 line amendments before you. There will be 3 additional line amendments. The additional line amendments are on line 139, after emergency services, insert employment services pursuant to. And the second amendment is on line 140, after the ETSEC, at the beginning there, strike employment services and insert as amended. That is just a cleanup. The terms employment services should have been on line 139 prior to Title III of the Older Americans Act. So what this will now read is client services means emergency services, comma, employment services pursuant to Title III of the Older Americans Act, as amended, comma, health, education, and screening, and then the line goes from there. So the third amendment, how to explain this? Okay. So there was an amendment adopted in subcommittee. I'm trying to find the easiest way to make sense of this. This new third amendment is essentially Amendment 7 that was adopted in the subcommittee, but there's a 4-word change. However, to get it in the proper posture, we had to reject 7 and adopt this new one. The new one is the same definition of long-term care as is available online and framed as Amendment number 7. If you're looking at that in your packets or online, what the new amendment is the same definition with the last 4 words stricken. So we are taking the words "or" and "assistive device" out of that definition.
Delegate Warrock.
I move the amendment.
Delegate Keem, do you want to explain your bill?
Sure, Mr. Chairman and members of the committee. First of all, I do apologize for trespassing so much on your time, but let me start by telling you that the key word that was mentioned by the council is the words cleanup, and this is really what this bill is. I know it's long, there's lots and lots of line amendments. The reason why is the nature of this bill is a code cleanup section. As a result, there's a lot of technical amendments. I'll assure you that the reason why we're doing this bill is back in 2012 when the Department of Aging and the Department of Rehabilitation Services were merged. As part of the merger, as the different organizations were trying to be put together, there were a lot of code sections that were redundant and or duplicative and or just outdated. So that's what we're trying to do to clean this up. There was a work group that spent many months working on this, but as natures of these cleanup type things go, after we saw the subcommittee action, we noticed that there were a few more technical changes to comply with federal law and such. So they really are largely technical. I thank the subcommittee chair and the subcommittee for their time a few days ago when we went through this, and I apologize that we didn't catch these last changes in time for the subcommittee, but they really are just technical in nature.
Are there any questions for the patron? Does anybody in the audience care to speak on this bill? There's a motion to report as amended, and it's been properly seconded. Please cast your vote on the electronic voting device. And the bill reports 20-0. Congratulations.
Thank you, Mr. Chair, Madam Subcommittee Chair. I appreciate your time.
And the last bill from Social Services, Delegate Guzman.
Thank you, Mr. Chairman. House Bill 1371 from Delegate Bourne has been reported and referred to Appropriations 6-0. It talks about TANF and the diversionary cash assistance, imposes a minimum threshold of $1,500 on temporary assistance for needing family diversionary cash assistance. The bill provides that any person who receives TANF, diversionary cash assistance, waive his eligibility for TANF for the number of days for which assistance is granted, multiplied by 1.33, and so move.
Committee, there's a lot of demand for funds in TANF that we look at every year, so the motion is to report and refer. Is Delegate Orrock.
Yeah, Mr. Chairman, if someone could just explain why we needed to put a floor of $1,500, because that's the underlying policy here. The other part I understand, the latter part, but someone from the department who could kind of speak to us how that, you know, what 120 days, which may exceed 1,500, but now if it wouldn't, you got to give 1,500. I mean, I presume the administration or department asked for this bill.
please introduce yourself to the committee.
I'm Mark Golden. I'm the TANF Program Manager at the
Golden.
Department of Social Services. The increased amount was more to deal with different kinds of needs that would be presented by applicants and gives us more flexibility to address things like eviction or rent, which are not often covered because the amount isn't high enough.
Mr. Chairman, follow up?
Yeah, Delegate O'Rourke.
And I get that part of it, but now we're saying it's a hard $1,500 floor, and the top can go above that, whatever would be up to 120 days.
When it's up to $1,500. When we calculate the amount, it would be based on the person's needs that are presented.
Delegate O'Rourke, this summary is not correct.
But I'm reading the legislation in line 15, 120 days or $1,500, whichever is greater. So the language clearly says we're building a hard $1,500 floor.
Mr. Delegate O'Rourke, it says up to. It says up to 120 days or $1,500.
Whichever is greater.
So that's a cap. Am I?
We're saying which of those two numbers is greater is what it can go. Okay.
Mr. Golden, can you decipher this?
Let me just walk through a situation. They
Okay.
Never mind.
There's been a revelation occurring here.
Okay.
All right. We're good. This is another option. Okay. So the bill has been moved to report and refer to appropriations, and it's been properly seconded. All in favor of reporting and referring, please indicate on the electronic voting device. And the bill passes 19 yeas and no nays. Thank you, Delegate Guzman.
Thank you, Mr. Chairman. I would like to commend the bipartisan support on the bills out of my subcommittee.
Which has been requested to go by for the day. Is there a motion to do so? Okay. Without objection, it's by for the day. Delegate O'Quinn, with your HB 1281. Sorry. Delegate O'Quinn, you're bringing to us HB 1281.
Yes, Mr. Chairman. Mr. Chairman, House Bill 1281 is a Section 1 bill that would allow a 3-year lease pending approval of the executive branch of an unused building located on the grounds of the Southwest Virginia Mental Health Institute, which has been previously operated by the Department of Behavioral Health and Developmental Services. Essentially, that building has been used for storage for several years now, not doing anything constructive, and so the community through the local CSB wants to create what they've titled the Appalachian Center for Hope, which is going to be a recovery program designed to address the region's addiction issues. And of course, as we all know, the opioid crisis was declared a public health emergency in the past. And so this is an attempt to be able to utilize an existing structure that is not doing anything functional at the moment. It's going to come in actually 3 phases, with the operative legislation, of course, coming first, and then I'm opening in phase 1 as a therapeutic community program for women, and then ramping up to a bigger and broader program. And so, so this bill initially allows for that lease. It does have a budget amendment attached to it as well, which I have filed with appropriations.
Any questions for the patron?
Yes.
Is there anybody in the audience who would like to speak in favor or in opposition to the bill? The proper motion would be report and refer if
Mr.
someone
Chairman.
would like to make that. Okay, is there a second? All right. The bill is before us. It's a simple bill.
Mr. Chairman?
Yes, Delegate Rasul.
I just had one quick question on the language. Mr. Chairman, Delegate O'Quinn, on number 2, the terms of the conveyance shall include a budget allocation to complete the budget refurbishment of the building in the amount of $2 million in the liability insurance. Is that, just so we're clear, that is what the budget request is for?
Yes, Mr. Chairman. The building is set vacant with the exception of a lot of stuff being stored for quite some time, and it's going to take a little bit of money to bring it up to snuff, and that's what the budget amendment is for.
Thank you, Mr. Chairman.
So this is a bill about whether we can afford it or not, which we'll take up on 13th floor. Any other questions? Okay, it's been moved and properly seconded to report and refer to appropriations. All in favor, please indicate on the electronic voting machine. The bill is reported and referred, 20 yeas and 0 nays. Thank you, Delegate.
Thank you, Mr. Chairman.
So
I've got a little bit.
we have no patrons here, so in the audience, we have a lot of bills from members of the committee here that we can take up, and Delegate Rasul has indicated he would like to take up HB 378. Is that correct?
378, thank you, Mr. Chairman. Members of the committee, if I can draw your attention to House Bill 378, which repeals a sunset by extending a program around comprehensive harm reduction. As we know, as the previous delegate had mentioned, we've declared this state of emergency a few years ago. This is a key program to fight and to address the opioid epidemic here. What this does is repeal that sunset that we had put on several years ago. The bill it promotes a trauma-informed approach to responding to the addiction crisis. So, Mr. Chairman, happy to answer any questions, and hope we report the repeal of the sunset.
Does anybody have any questions about this sunset repeal?
Mr. Chairman.
Delegate Orrock.
Yeah, Mr. Chairman, the only question, there's no expiration, if I understand, on the declared health emergency that was issued. And by repealing the sunset, this would allow, if ever, as in this case, the health emergency is declared, the health department has that power in perpetuity, absent further legislative action to rescind that. Would that be accurate?
Thank you, Mr. Chairman. Members of the committee, they would be able to rescind at any time the public health emergency? Yes, Mr. Chairman.
Follow-up question?
Delegate Orrock.
Yeah. Mr. Chairman, and I don't disagree with the underlying premise of the bill, but I believe that was why we put the sunset on in the first place, so that we could periodically reevaluate, did the emergency conditions still exist? And I'm not aware, and maybe someone from Health Department can help me on this, how, there is no provision for y'all to ever rescind. How would that be handled?
Welcome. Can you please introduce yourself?
Sure. Good morning, Mr. Chairman, and good morning, committee. I'm Diana Jordan from Virginia Department of Health. For as long as the public health emergency is in effect, you're correct, we would continue to be able to authorize programs and operate them. When the conditions that caused the public health emergency to go into effect, if the commissioner were to stop that emergency declaration, then these programs would no longer be able to operate.
Okay. Any other questions? Any further questions? Has this bill been moved? There is no motion. Okay. Is there a second? It's been properly moved and seconded that we pass HB 378. All in favor, please indicate on the electronic voting machine. Okay, the bill reports out 18-0. Does anybody on the committee want to volunteer to go next, or should I just pick somebody? All right, Delegate Guzman, HB 580. Oh, she's gone. Okay. Delegate Hope, you've got 3 bills here? No, he's gone. I need to look up. Delegate Hodges, you're here. Okay, and you have a series of 3 bills?
Thank.
Well, which one are you going to take up first?
Let's see what I have here. House Bill 1260, Advisory Board on Athletic Training, the membership.
We're looking at HB 1260.
Thank you, Mr. Chairman. This provides that one member of the advisory board on athletic training shall be an athletic trainer who is currently licensed by the board and has practiced in the Commonwealth for not less than 3 years. I believe that's already the case. And is employed by the public or private sector. So if you really look at line 25, it just adds public. So basically what we're looking at is fire, EMS, and those folks being able to serve on the advisory board. And this comes from a recommendation of a work committee, I believe. Some folks have got together.
Thank you, Delegate. Delegate Adams.
Thank you, Mr. Chairman. My question is, by adding the public or, wouldn't there be the possibility that this would make up 3 members of the public sector if the one athletic trainer is employed by a secondary school that may be part of the government, the one employed in an institution of higher education that could be a state-based entity, and then another public sector? Wouldn't that possibly then make up no members of the private sector?
Currently, the way I see that worded, that could be a possibility. If I may, I do have some folks that can speak to this if they are here. I know there was extensive discussion, and they worked through this quite a while, so I'll let you know what happened in those discussions. So.
Hello, my name is Chris Jones. I'm the president of the Virginia Athletic Trainers Association, and as the advisory board met, we feel that right now there is a section of the population of certified athletic trainers that don't have the ability to serve on that advisory board. So this will allow, it could be someone from the public sector or the private sector, but I think by opening up, it lets the, the Board of Medicine make that decision of those people that are best fit to serve the committee.
Further questions from the committee? Members of the public wish to speak further both for or against the measure? Do we have a motion? It's been reported, properly seconded. All those shall indicate their vote on the electronic voting board. The bill reports 17-0. The patron.
All right, thank you, Mr. Chairman. House Bill 1261, again with athletic trainers. This allows athletic trainers to possess and administer naloxone. We've seen it before. We're trying to expand that and get naloxone into the hands where it can do the most good, Mr. Chairman, and prevent overdoses. A fairly simple bill.
Thank you, Delegate Hodges. Members of the committee, have any questions? Any member from the public wish to be heard? The measure has been reported. The measure has been motioned and properly seconded. All those in favor shall indicate on the electronic voting board.
And your last bill?
Thank you, Mr. Chairman. House Bill 1263. This is something that we deal with every year. Typically, Delegate Scott Garrett carried these bills, but this adds the Schedule 1 chemicals to the Drug Control Act that have been added through the expedited regulatory process by the Board of Pharmacy. The way it works now is the Department of Forensic Science identifies these chemicals, gets them over to the Board of Pharmacy. They add them through regulation, and we need to codify that. I'll be glad to go through these chemicals and read them off if you would like, Mr. Chairman, but I think
Delegate Garrett would like to read all those words. He'd like to read all of them.
Yeah,
so, no, I think you need to do that.
Yeah. Oh, I'll be glad to. It's been
Just
a long
give us
time
one or
since
two.
Medicinal chemistry, but we can
Just give us one or two.
One or two?
Okay, everybody listen up.
Where are
He's
we,
going to
Mr.
perform
Chairman?
here.
I think the last page, we'll do this off the cuff, Mr. Chairman.
Okay, that's okay.
You ready? Methyl 2,1,4-fluorobutyl, 1H indazole, 3-carboxyamido, 3,3-dimethylbutanoate, and another name is 4-fluoro-MDMB.
Anybody have any questions for the patron? Move to report. Been properly.
And there is no
second.
budget amendment.
All in favor of reporting the Drug Control Act amendments, please indicate by voting aye. And the bill reports 19-0.
Thank you, Mr. Chairman.
Thank you, Delegate Hodges. Okay. Do we? We have.
Yeah,
Eric or Bell?
we did hers.
We did hers?
Delegate Bell is here.
Okay. Delegate Bell, you've got two bills? Just one bill? And which one is that? Okay.
Mr. Chair, members of the committee, this is an issue that will be familiar to everybody who was here in 2018. Mr. Chair, in 2018, we passed a bill requiring background checks on before adoptions were approved by the Circuit Court. They were generally being done as part of a general background check by DSS, but there was a case in Virginia Beach where an adoption was performed. The adoptive parent killed the child. The father's here to testify about that if we need additional testimony about it. That bill passed. It was 97-1, almost unanimously. Everybody on this panel who was here at the time voted for it. There's a sunset provision put in for 2020. This would remove the sunset. In addition, since that bill passed last year, we then created a new sort of route for close relative adoptions. This would also cover that, because otherwise that would create a route whereby a step-parent who wanted to avoid the background check could use that as a close relative adoption. That's what the bill does.
Delegate Bell,
Mr.
do you have
Chair.
a substitute?
No? Yes, I think staff has a substitute, and then staff
Okay.
is discussing the second part.
I move the substitute be accepted by acclamation, by general consensus.
Mr. Chair, raise an issue just in case the committee wanted to do that. If it did, it wouldn't be ready today. This is narrow. This only goes to step-parent close relatives. If we wanted to apply it to all close relative adoption, staff has said that's possible. That's not what the bill does. It's not the purpose of the bill. That might be an issue we want to take up someone else's bill, or if the committee wants, while we're in the space, to do it right now. I'm not adverse to that, but I don't want to, that's not what the bill was intended to do.
Okay.
The close relative issue was identified sort of as this went through the process. It was brought to me simply to eliminate the sunset.
So, Delegate Bell, can you explain the substitute, or we want council to do that?
I counsel too, but I'm happy to talk about it.
Go ahead.
I can do it.
Yeah.
Okay. So what the substitute does is there are several different routes a family can take, routes that can be taken to adopt a child. The original bill is drawn to the article that addresses adoption of a child by a step-parent. The substitute adds two sections that are in the article about adoption of a child by a close relative. The issue that Delegate Bell identified arose when, I believe it was last year, we amended the definition of close relative to include a step-parent. So the step-parent could adopt through the close relative approach or the step-parent adoption approach. What the substitute does is it amends the two sections that lay out procedures for close relative adoptions to include the same language that was included a couple years ago in the step-parent adoption section, and would require that in the case of a close relative adoption in which the adopting party is the step-parent of the child to be adopted, so it narrows that universe, the court will require the National Criminal History background check, just as we require for step-parent adoptions under the step-parent adoption article.
Are any questions for council? It looks like there's somebody from the audience who'd like to speak to the bill.
Mr. Chair, this is Mr. Hoffer. It was his daughter who was killed by the adoptive stepfather. He is prepared to testify. I've also said that since this is a removal of a sunset that was passed a couple years ago, this committee may be, I'm not trying to drag this out, and if it's going to be favorably reported, he's comfortable just with the proffer we've made. But if there's any doubt in anybody's mind, I think
If he'd like to speak, he's welcome to speak. Otherwise, we can pass this legislation.
I think we're okay. Yep. He says if it's going to pass, it's
Okay.
fine. It's just, it's.
I think it's going to pass. So it's been moved and seconded. If there's no further discussion, excuse me, there's someone from the audience who'd like to speak from Poverty Law Center. Valerie.
Yes, Mr. Chairman, Valerie LaRue from the Virginia Poverty Law Center. So an alternative view on this issue is that if a child is living in a home with a step-parent, that step-parent is their step-parent regardless of whether that step-parent then adopts the child. So if the step-parent is concerned about having a background check because they might have a barrier crime on their record, what they will do is they will just not adopt the child, but they'll still be living in the home with the child. So I don't know that this measure would prevent that tragedy from happening because the family would still be together. If the step-parent doesn't adopt the child, and let's say that the reason why the step-parent is adopting the child is because there isn't another parent there. I mean, you can't have two. You can't have three parents, basically, legally. Right. So in that case, if someone has a barrier crime on their record and they think, well, I don't want to go through this process and go through the investigation, then what they will do is they just won't adopt the child, but they would still be living with the child. So the problem with that is that if, for instance, the two parents, now the step-parent and the biological parent, get divorced, the step-parent will not owe any child support for that child because they won't actually be the child's parent. Whereas if the step-parent adopts the child, that step-parent is now not a step-parent but a parent. And so then that parent legally would owe child support to that child. But if they don't adopt them, they will never owe any child support because they're just a step-parent and don't have a legal obligation to the child. The same thing comes true with inheritance. If that step-parent dies as a step-parent only, the child is not entitled to inherit anything. If the step-parent adopts the child, then the child is entitled to inherit things. So it just makes me concerned that we, by creating a situation in which a step-parent who might be a perfectly wonderful step-parent in all respects, but doesn't want to go through this process of having the background check and being investigated for fear of being denied, because there are many barrier crimes that can be, in fact, barriers to adoption, that we would be creating a situation where we would leave the child less well off because of this bill than they would be without it. And that's my only concern, but I just wanted to bring that to the committee's attention. Thank you, Mr. Chairman.
Anybody else from the audience before the patron replies to that comment? How would you address that, Delegate
We
Bell?
can't fix everything, and obviously you have parents who bring dangerous people into the households, and I think most people know that the child abuse statistics are, especially with sexual abuse, are atrocious and usually brought by someone who knows the child and often brought by someone in the house. And I'd love to fix all of those things. I don't know that that is the ability of this bill to do that. We're simply saying that if you're going to adopt, and actually it's not so much a barrier crime issue as simply making sure the court is informed. We were told 2 years ago, and this was Delegate Staley's bill, so I didn't, it's from Virginia Beach, and he's no longer with us, Delegate Staley, so he asked me to bring this on this year with the sunset. But, I mean, we were told that it's usually done anyway, that a good social service investigation has a background check. In this case, it was not done. Would it have prevented what happened? Obviously, we don't know, but it's one of the things that might have identified the gentleman who was the adoptive father as not being a good prospect for the court to endorse. So with that, and again, if there's a serious doubt about it, I don't want to I'm not trying to cut him off. He came up from Virginia Beach. He's happy to testify about what happened. He's not my constituent. This was not even my bill when it first went through. So that's with all that.
Yeah. So a legitimate argument against it, which would be your argument would be overwhelmed by this, is that if we pass this bill, it would be a disincentive for the de facto step parent to become the legal step parent.
And that would then reduce the legal ability by that person who then would not be a adoptive parent. We're calling them a step parent. They're not really a step parent. At that point, they have no legal ability to tell the child where to go, what to do, who they could see, what medical care to receive, whether they could go to the nurse who could find the evidence of the abuse, all of those things. They're not the parent. At that point, they're just mom's husband, I guess.
Okay, is there,
I'm not denying that there are much larger issues than this, and hopefully we will one day figure out how to fix those. This is a fairly modest little issue.
Okay. Delegate Aird.
Mr. Chairman, Delegate Bell, can you clarify a statement you made? You said to some extent this is already occurring?
What we were told 2 years ago, now we haven't heard any testimony, this came straight to committee, was that when social services, so an adoption is proposed, that the court then in most instances gets a social service investigation and that a background check is performed as part of the social service investigation. Now, subsequent to this bill and the whole idea of it, we've expanded this issue of close relative adoption. That's not what this initially was about. This was initially just about the adoption process and requiring to be sure every time there's a criminal background check done, because don't always make it the mom and the dad, but the mom may think she knows the guy. The mom may really think she knows the guy. She may not know the guy. And what she thinks would be a good choice, in fact, has a background that she doesn't know about or knew kind of about but didn't want to think about, or all the reasons that this might happen. Now, since then, the close relative adoption has become a different route for adoptions, and in that we actually have a step-parent section. And so what had initially, 6 weeks ago, just been an eliminated sunset clause now has a provision to make sure that in the close relative adoption to which we added step-parent, that there would also be an avenue for the background check there.
Thank
now,
you.
It's not preclusive, and so if there's a modest misdemeanor or something, I assume it's up to the court. But if there was a sex crime or a serious felony from a few years ago and the person was a real risk, that might not be someone the court or at least might want to consider as part of the adoption approval process. And I don't do this kind of work, so I have no particular expertise in the court system for this.
Any further questions for the patron? Is there a motion on the bill? Okay, the substitute has been moved and seconded. All in favor, please indicate on the electronic voting machine. And the bill passes on a vote of 18-0. Thank you, Delegate Bell. Delegate Robertson, you have HB 1399. Did we already take it by? Okay.
The last two we have 299 and 997, but I don't see any Congress.
I don't see the two bill patrons. I have a bill or two bills.
You have just one committee chair.
Excuse. So I just it's bill 299, and it is allowing a medical assistant to apply fluoride in the dental office, and we have an amendment to the bill.
Two line amendments to this bill. The first line amendment, line 229, after the word nurse in the existing language, strike the words medical assistant and strike the existing or. Second line amendment, after hygienist, insert comma or authorized agent of a doctor of medicine, osteopathic medicine, or dentistry.
All in favor of the amendment, say aye. Okay, this is pretty straightforward. Does our resident dentist want to comment on this momentous bill? Okay, never mind.
Mr. Chair, thank you for bringing the bill up, and yes, fluoride is good for people.
Very good, and now it can be applied more widely to your teeth. Does anybody would like to speak to this bill? I mean, people have come by to see me in my office about this. Where are you? Okay. Thank you. Please introduce yourself and welcome.
Hi, thank you, members of the committee and chairperson. I'm Sarah Holland. I'm the CEO of the Virginia Health Catalyst, which is a statewide oral health advocacy organization. We are strongly supportive of this bill. It came to us actually from our pediatric partners who indicated that this was a barrier to introducing fluoride varnish application to their young children in practice.
Thank you. Okay, committee operates by motion. Okay, all in favor, please indicate on the electronic voting device, and thank you for coming. Okay, the bill reports out 18-0. Thank you so much. And, excuse me. Audience, I am tempted to wait to see if these bill patrons show up, but maybe we can just go early. What do you think? Is there a motion to adjourn? Okay. All in favor, say aye. See you soon.